Hey, it's Dr. Charshan here. We're going to go over how to use a foam roller to loosen up the thoracolumbar fascia. The thoracolumbar fascia tends to get very tight because of the way we put torsion through the mid-back. It's difficult enough for us to work with by hand in the office. However, I've developed this technique over the last 6 months of how you can use a foam roller to do it. While it's not going to be as perfect as what we do in the office, I think you'll find it very helpful. The thoracolumbar fascia runs from the lower back to the mid-back region. If I were to show you on my own back, the area would be from here and all the way up into the shoulder blades. Now what happens with a lot of people is when they get distortion in their hips, meaning that their hips distort, the upper back will distort too, and so will the mid-back. That causes the thoracolumbar fascia to thicken, tighten, and as a result of that, it can create a lot of pain and a lot of dysfunction in both the upper back and the lower body. So I'm going to show you a very easy way to get at it and work it. First thing you're going to do is you're going to take the foam roller. We're going to place the foam roller on an edge right by the spine, but just a little bit next to it, right on the muscle bundle. We're not actually going to be working on the muscle, we're going to be working on the fascia, which is tight surrounding it. That's actually what's restricting the motion. To do this properly, what we're going to do is we're going to move our legs forward, kind of like what I'm doing here. And the first thing we want to do is we want to go ahead and start on one of the lower portions of the thoracolumbar fascia. I don't want you to hunt around to see what's stiff and what's sore. Some of this might be, but we're not trying to dig into anything in particular, just using our body weight. The second thing that we're going to do is we're going to raise our arm up. Now, you may feel a lot of tension in there. If you are, I want you to keep the arm raised until that tension starts to ease up. So you may notice as I'm doing this, my arm's coming back a little bit as I stand there. And as it continues to open up and continues to go up a little bit farther, the next thing I'm going to do is I'm going to raise my leg up. So you'll notice that I'm raising my leg up. Now what this does is it puts further tension on that area of the thoracolumbar fascia. This is very similar to the way we do it in the office. However, doing it this way enables you to loosen it up yourself if you're at home, if you're trying to do exercise and you're noticing it feels very tight. Now as I'm doing this, you're noticing that I'm going ahead and bringing this medially across my body. And you'll notice that the leg's moving slowly. So as I'm doing this, it's very tense. And just like when we do it in the office, it takes a little bit of time. And eventually, the leg will start to go down. And when it starts to go down, you've loosened up a pretty nice chunk of that thoracolumbar fascia. The next thing you'll do is you'll take the foam roller and you move it to the next area. And again, bring the arm up, just like we did before. And wait till it opens up. Wait till it loosens up. You could even help it with the other hand if it's very stiff. It'll open up, but it's not going to open up as quickly as you'd like it to. It's going to open it up at its own pace. And then again, from the next area, I'll bring the leg up. You may even find that that's even more difficult. Maybe that area is much more bound up than the previous area that you just worked with. And then we're going to do the same thing. And the idea is to continue to go ahead and move up and move down according to what's tight and what's not. If you've done this effectively, you will feel better and you will feel much more freedom of motion than you did prior to doing the technique. And then I recommend always doing it on both sides, because if you do one side and not the other, the likelihood of guessing wrong is at least 50%. If you do both sides, you're most likely to feel better, even if it's not perfect.